Hi, my name is Dr. Matthew Connor and I am a surgeon at Tallahassee Ear, Nose, and Throat. Today we are talking about septoplasty and inferior turbinate reduction. What is a deviated septum and what is a septoplasty? The septum is a midline structure that divides the nose into the left and right sides. In the front of the nose, it is made of cartilage, while towards the back of the nose, it is composed of bone. In some people, the septum is deviated towards one side or both, thus limiting the amount of airflow through the nose. The deviation can be a result of trauma or can be present since birth. A septoplasty is a procedure that removes or realigns the deviated portions of a septum while at the same time maintaining the necessary support and stability of the nose. Next, what is an enlarged inferior turbinate and what is an inferior turbinate reduction? The inferior turbinate is one of three lateral swellings in the nose that functions to warm and humidify the air we breathe. However, in many people, the inferior turbinate can swell too much and cause severe nasal congestion. An inferior turbinate reduction is a procedure that reduces the size of the inferior turbinate by removing excess bone or soft tissue in order to enhance nasal airflow. Patients who have chronic nasal obstruction that does not benefit from medical therapy may benefit from septoplasty and inferior turbinate reduction. The surgical procedure itself is done intranasally with no incisions made out on the face, and patients can go home the same day. This surgery is very common, and most patients do very well without any complications. Minor nosebleeds may be expected, but rarely patients may experience a severe nosebleed. If this happens, the bleeding may need to be stopped either in the emergency room or with another surgery, but this is very rare. If bleeding occurs, spray oxymetazoline, also known as Afrin, into your nose. 2 sprays into each side that is bleeding every 5 minutes for a total of 3 times. And apply a gauze pad or tissue paper under the nose and rest, sitting with your head up for approximately 30 minutes. If you still have minor bleeding, you may repeat this procedure. Try not to remove the gauze pad unless it is completely saturated. The pad will help the blood to clot inside your nose. Because bleeding is a risk, we ask that you not take aspirin-containing products for at least 10 days prior to your surgical procedure. We would like you not to take ibuprofen drugs for 5 days before surgery. In addition, we would like you to discontinue any herbal supplements you take the week before surgery. Avoid the use of any nasal decongestant nose spray for 14 days prior to surgery. Post-operatively, you should not undergo any strenuous exertion, straining, vigorous nose blowing, or heavy lifting for 2 to 3 weeks after your surgery is performed. Numbness and swelling of the nose and numbness on the roof of the mouth and upper teeth may occur after surgery. This usually resolves within a few weeks and very rarely may be permanent. You may also have a change in the sense of smell. Splints are sometimes placed in your nose to ensure that the septum remains straight. These splints are sutured into the nose and will be removed in the clinic 1 week after surgery. Very rarely, there is the potential that there will be a hole that will develop between the right and left sides of the nose through the septum, called a septal perforation. Generally, these do not cause symptoms, but occasionally can cause problems with crusting around the edge of the perforation, bleeding, or sometimes a whistling sound as you breathe through the nose. As in any surgery, there is always the risk of an infection, though fortunately, this risk is low. It is also extremely unlikely that your nose will change shape after this procedure. The important thing to keep in mind as you're considering this operation is that even though it does have a number of potential complications, they are all exceedingly rare. In general, over 90% of people who undergo the surgery have a remarkable improvement of their nasal airway, and the satisfaction level for this procedure is very high. We have a great deal of experience with this procedure since it is one that we perform frequently. We hope this video has helped you to understand the risks and benefits of septoplasty and inferior turbinate reduction and what to expect during your recovery. If you have any further questions or concerns, please contact our office at any time.